Hey there, John Cummins. Just want to talk about, how do we protect our arteries? With Shane Warne's untimely death, it certainly generated a lot of inquiries with our practice as people wake up to the fact that yes, you can have a heart attack at 50 and that could be the end of you. So all doctors are familiar with the traditional risk factors of heart disease. So being a male, is a risk factor. Women also have risk, but they tend to lag 10 years behind men, and certainly the risk goes up post-menopause. So being a male, getting older, high blood pressure, a smoker, or even past history of smoking, either diabetes or pre-diabetes. There are various other specific things such as having rheumatoid arthritis, maybe having psoriasis can do it. But these common ones, we can work out your 5 or 10 year risk based on these common, readily available risk factors. With a simple blood test of blood pressure and looking at age and gender. And family history. If a male under the age of 55 has had a cardiac event that's a direct first degree relative, or a woman under approximately 60, that can double your risk. Now, the risk calculators are great, but what outperforms all of these is basically imaging the arteries, either with just looking for calcification alone in the arteries, and I'll do another talk about what is calcification later, or looking for calcification and then putting a dye in the artery and looking for soft plaque. Now, the current global guidelines would suggest that when someone's risk hits about 7% 5-year risk, and for most of our clients that are fairly well managed and manage themselves fairly well, that would tend to occur around the age of 60 in a man, probably 70 in a woman. Then it's a valid thing to do it. I actually do it 10 years younger than that, because I found that about 1 in 8 people with very good risk factor management actually have a plaque in their arteries, disease in their arteries. And you could make an argument that if you catch it very early, and if I've got a person whose arteries are average for their age, I would say to them, look, why would you want to be average? If you're average, you're going to die at an average age, and you're going to die from average things, which could be a heart attack or a stroke. And I would put together a process for them where we can get them to slow down the plaque formation, which often, almost invariably involves a statin, and then re-image their arteries a few years later and just track it. Some of the imaging of the coronary arteries that we've done have been absolutely life-saving, and I say to my clients, look, it's probably the most fruitful 45 minutes of your time in your life ever, which is the time spent under the scanner. And the major side effect would be radiation. And I also say to my clients, look, you don't want to have too many CT scans in particular, because radiation alone is carcinogenic and cause a cancer. But the value that one gets out of a normal coronary artery imaging around the age of 50 for a man, 60 for a woman, is tremendous. And if you've got normal arteries, then you are statistically incredibly unlikely to have an event for the next 10 years. And that gives a lot of peace of mind, and it means that people can push their hearts and not be concerned that something's going to break and fly off and cause them a problem. So I believe that the best way of looking for early coronary artery disease is to look at the arteries directly. Everything else is a risk, and it's a pointer, but it's not as accurate, in my opinion, as looking at the artery directly. And I hope that helps, and happy to field any inquiries should you wish to contact us.